Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Jani, and with me is Dr. Adrian today. He is oncologist at Thunder Bay Regional Health Science Center. Today we are going to talk about breast cancer. Breast cancer is the second most common type of cancer after skin cancer in women. In US in 2016, 246,000 patients are diagnosed with the breast cancer, out of which 40,000 patients died with the breast cancer. In Canada in 2015, 25,000 patients diagnosed with the breast cancer, out of which 5,000 patients died with the breast cancer. It is the statistics say that 1 in 9 women will get a breast cancer in the lifetime. So breast cancer is quite a significant disease, and not only women but men also can get breast cancer. So today me and Dr. Adrian Chan are going to discuss about the breast cancer. Welcome, Dr. Chan.
Thank you.
Thank you for coming for the show, Talk with Your Doc. And in our practice, day-to-day practice, we see a lot of biopsies and you see a lot of patients with the breast cancer. So if somebody's family history is a breast cancer, is that a risk factor for somebody getting a breast cancer?
It is. Having a close relative like a sister or mother or daughter who has breast cancer does increase your risk of getting breast cancer yourself. And if you have two close relatives with breast cancer, the risk is even higher.
So if my family history is positive for breast cancer, what are the tests we can do to diagnose this at an earlier stage?
Well, the usual screening test to check for cancer when you are well and don't have problems or symptoms of cancer is, for breast cancer, usually a mammogram.
And how about the BRCA mutations? Is that a risk factor for the family history?
Well, about 5 to 10% of breast cancers are hereditary genetic disease, where people are born with a mutation in a cancer-related gene that's in all the cells of their body, and that they can pass on, to their children, and that significantly increases the risk of getting breast cancers. Most of those genetic mutations are in the BRCA1 or 2 genes, and sometimes testing for BRCA1 or 2, or at least some genetic counseling, may be indicated. If there is a very strong family history of breast cancer, or for example, if there is a history of someone getting breast cancer in the family at a very young age, like less than 40, or at least less than 50, or if there is a young woman with bilateral breast cancer in both sides, or if there is a family history of both breast cancer and ovarian cancer. So some examples.
So BRCA1 and 2 mutations are if they are present, then it is a risk for the breast cancer as well as the ovarian cancer. So
That's right.
Is this BRCA1 and 2 normally present in the normal patient, normal people? And what is the role of BRCA? What do they do in our body?
These genes are involved in DNA repair. They repair DNA damage. Right? So if you're deficient in one of these genes, you're more prone to developing genetic mutations. Right? You can acquire, these BRCA mutations in a cell in your body, right? Through, maybe perhaps due to exposure to things in the environment or things in your diet that causes changes in our DNA, right? But that is different than being born with this mutation that is in, all the cells of your body. If you have that genetic predisposition, there is a much higher chance that you will get breast cancer than the average person.
So average person does have a BRCA1 and 2, but they prevent against the cancer. They prevent the cancer in the patient. But if they are mutated, then they lead to the cancer probably.
That's right. Yeah. I mean, anyone can have changes in their cells that can lead to cancer. Usually it's multiple changes over time. But if you're already born with this genetic predisposition, you're already at a higher risk or predisposed.
So how can we test this BRCA1 and 2?
It's usually a blood test.
Blood
Yeah.
test. Okay. So is there any genetic counseling required before somebody does this blood
Yes,
test?
you should be referred to a genetic counselor, and they will review your family history of cancer
Right.
and advise whether or not it's appropriate for a person to have BRCA1 or 2 testing. And then it's a
So
blood test.
if somebody's family history has a breast cancer, the first degree relative has a breast cancer, in addition to mammogram, does BRCA1 and 2 testing help those patients to screen for the breast cancer too early?
You wouldn't normally do BRCA1 or 2 testing as a sort of a screening, you know.
Right.
Yeah, it is usually something that is considered based on, you know, high risk, you know, features, like, as I mentioned before, including strong family history, and you know, upon the you know, counsel of a genetic counselor.
Now there is a people understand that oral contraceptive pills causes breast cancer. Is that true?
There is some increased risk with using oral contraceptive, you know, medication, but the risk decreases with time. So, you know, it's been more than 10 years since you have had the oral contraceptive pill, then there's not a significant risk.
Does wearing a bra causes breast cancer?
That has not been clearly shown. There's been some, you know, studies done, and I think a book written suggesting that might be so, but the research does not really confirm it.
We hear a lot of internet rumors and emails.
It may be more of a rumor, or it may have to do with the fact that women with larger breasts, or women who are obese or overweight, may have larger breasts and may be more likely to, you know, not wear a bra as often, and we know that being overweight or obese is a risk factor for breast cancer.
Now, does abortion causes breast cancer?
That has not been confirmed by research either.
Right. So there are lots of myths about the breast cancer. One of the myths is does diet or the lifestyle factors, does it causes breast cancer?
There are some factors, risk factors for breast cancer that can be modified, and so there are some lifestyle things that may increase your risk of getting cancer. One is weight, as I said, being overweight or obese increases your risk. Activity also has been shown to be helpful in reducing, you know, risk of breast cancer, moderate activity. And also alcohol consumption as well has been associated with increased risk of breast cancer.
Smoking, is it?
There has been a little research that suggests that there may be a slight risk of increased risk of breast cancer associated with smoking, and some limited evidence suggesting possibly secondhand smoke as well.
Right. One of the article I read, they said about coffee and the breast cancer. There's possible risk, and people who have been diagnosed with the breast cancer, they drink a lot of coffee, and they say that if you reduce the consumption of coffee, possibly there might be reduction in the breast cancer risk. That is one of the minor factor probably.
Right. There may be some minor factors that are, you know, suspected but not, you know, strongly confirmed.
Yeah. Yes. Thank you, Dr. Chan. Please stay back, and we'll get back to you after a short break. Thank you.